Welcome to Encounter, where we celebrate putting faith into action and community leaders who live out compassion, grace, and love. We're a program of the Broome County Council of Churches that addresses food insecurity through CHOW and the Greater Good Grocery, provides hospital and jail ministry, builds wheelchair ramps, and assists neighbors with transportation and shopping services through Faith in Action volunteers. We invite you to the conversation. Encounter your neighbors as we learn to walk together in love and kindness.
Good morning and welcome to Encounter. I'm your host today, Joe Sellepack. I'm the Executive Director at the Broome County Council of Churches. As many of you know, CHOW is one of our largest programs. It's actually, in terms of the community, it's probably better known to people in Broome County than maybe even the Council of Churches is. It's a household name. CHOW, when people hear it, they know that it's part of the community's efforts to help its neighbors with food insecurity. And CHOW is obviously one of those programs too that evolves and it grows. And in order for us to kind of talk a little bit about what's going on at CHOW, I invited a couple of guests today to be with me. First is Scott Bombard. He is actually a chef, and we're going to be introducing a new program that we're currently working on today. So welcome to Encounter, Scott.
Thank you.
Thanks. And of course, there's Les Aylesworth, who's no stranger to Encounter. He's been on several times. So Les Aylesworth, who is the CHOW director, welcome to Encounter today.
Thanks for having me.
All right. So let's start off with asking the question, like, what's going on at CHOW? Because there's always something going on at CHOW.
Always something going on at CHOW.
We were talking about that just today. No day at CHOW is the same as any other day, right?
Very, very fluid, very much interesting, to put it mildly. So, last year we had a record-setting year again of distribution. We distributed almost 3.9 million pounds of food. And coming into 2025, we saw that continued distribution increase. Then in the early part of the year, we suddenly saw a dip in our food recovery work. Donations started coming down, and persistent inflation, lack of food out there has just made things kind of challenging right now. So we've been seeing reduced donations, reduced amounts of food to be able to give out to the community. So coming out of a really high point last year with high need, high amounts of food, we're seeing less food, but the need is even higher. So it's been, like you said, never a dull day, never an uninteresting day.
Because kind of a double whammy at that point. So you have like a less in supply, but increase in demand.
Yeah.
And it makes it really hard, especially, if we were selling something at that point, you start raising prices, right?
Correct.
But you're not selling it.
We're not selling anything.
You're giving it away. So it's like
still giving it away.
Yeah.
And so, great, we bear the cost of that. And as you said, the need hasn't gone down, and there is this inversion. As the cost of food comes up, the need goes up, but the donations come down because people are spending more money on their own food. So it's like you said, a double whammy.
And what that means to you and to your program is that then you end up having to buy more food.
Correct.
Because you have less to give away, and so as a result, there's a need for greater donations in terms of just cash.
Yep.
So that you can access it, so you can give more food away to help meet the need.
Yep. Yeah, we're always shaking whatever branches are out there, whether they're people branches or vendor branches, or trying to find new sources of food, or getting whatever we can, because we have a mandate to help the community.
So the analogy of a treasurer at a church who has to squeeze lemons in order to make lemonade.
Yeah. And
then all they give her is the rinds, and she has to squeeze the rinds and to make lemonade, but she does. It's kind of what happens at CHOW is that we're constantly dealing with the situations, trying to make lemonade, but never quite having enough resources in order to do it, right?
Yeah, and so we're always having to be creative to find resources to help the community, and because of that, it's kind of forced CHOW to be innovative. It's forced the council to be innovative and try different things, which is partly why we're also here this morning.
Yeah. So Scott, You are the one of the newest employees at the council. Actually, when we started a new program at the council, we haven't quite named it yet. There are some ideas. We thought about calling it Manna, thought about other kinds of ideas, but we're in the we're it's so new that we're starting to think through, like, what would it mean, and how do you, like, community younger outreach warehouse is something that we know, and everybody knows what CHOW is and what CHOW stands for. Manna would stand for something, and you want to, like, kind of fill us in on that?
It would stand for making abundant nourishment neighborhood accessible.
All right.
So
MANNA.
Yep.
Yeah. So we're kind of we're working through that, and who are you, and what are you going to do?
Well, Scott Bombard. I've got about 30 years in the hospitality industry. I grew up locally and got into the hospitality industry with my grandparents owned Scott's Quagga Lake House. So
yeah.
So I grew up every summer seeing.
Is that how you got your name, Scott?
It is. It is. My wife jokes because I have 3 last names as my first, middle, and last. But I have worked at places such as the Ritz-Carlton, Hilton Hotels, and in senior living as well. So I have a extensive background, and plan on bringing all that knowledge to start this new program and see where it goes. I think the possibilities are endless.
It was interesting to me how you actually found out about this program.
It was the miracle of Rotary. We met at a Rotary event at Campi, and Joe was picking my brain on a new program that you were coming up with, and it was interesting.
Yeah.
And before we left, he asked if he could reach out to me when he was closer to help him out with a few things, and I said absolutely. And earlier this year, you reached out for some job descriptions, and the rest is history. I mean, it sounded too good to be true. I mean, it sounded so good that I want a piece of this. So
well, and it's interesting because he had a role in creating your own job description.
That's true. That's true. That's true.
Yeah, so it was kind of one of those, I call it a God moment, where you're just sitting there and you realize as you're talking, you've got, and it was not more than just a job interview. It was more than that. It wasn't even a job interview. It was just talking about about food and about the kind of food that comes into CHOW, and some of the, Les, you want to. People are probably going to be fairly concerned about making sure that we're still giving food away. This. So you want to say
Sure.
how this fits kind of into CHOW?
Yeah, and I probably should rewind the tape a little bit. You know, one of the things I mentioned earlier is how we've always had to be creative to help the community. One of the things that I'd say marked the Council of Churches is we've tried to see needs and figure out what resources we can bring to bear, and sometimes outside the box stuff. And that's kind of how this whole idea began a couple of years ago, with this identifying a need in the community, that there's this gap where people don't have kitchens, they may be homeless, so all they have is a microwave. Elderly people don't have means to get in groceries, and the pantries and meal sites fill a need, but they don't always fill every need. And so we'd gone to Canada and looked at some programs up there and saw that prepared meals were really a common theme, and we thought this might actually fill a gap in the community. And so we kind of brought this idea back and began chewing on it and mulling it over, and recognizing another part of our program is the Broom Bounty program, where we bring in lots of recovered food, and food that's, as I affectionately say, is past its sell-by date but not past its use date. And sometimes it's so near dated you just can't use it. And so it goes to the pig farmer. And we thought, we have this food that we could actually utilize by preparing it. And so this program began to develop. And so to the question or the point you were asking about before, we're still continuing to do all that we do. The pantries and the meal sites are an important part of what makes CHOW, but this prepared meal program was to fulfill another, meet another gap that we see in the system. And so we've been talking about it for the last couple of years, putting a lot of effort in and research and getting, many more minds around the table to discuss it. And, here we are on the cusp of it launching.
Because we had a pretty significant community group that met. So
Yep.
there were people from like the Rural Health Network, from Cornell Cooperative Extension. We had the head chef from Wegmans.
Yep.
We had people from BOCES. There were a number of people that were community foundation funders, Hoyt Foundation. There was a number of people that were all engaged with this work, bringing this idea to the table and beginning to formulate what that idea would look like. And one of the things that we started thinking through at the same time as that was the 1115 waiver,
Yep.
which is about how do people on Medicaid live. It's more than just like in order for you to have health, it requires more than just going to the doctor, right? So you have like what they call the social determinants of health. It's the way that we are as how like all of our habits, all of our the food accessibility that we have, our shelter,
Right.
all the things that go into making a healthy thing, and so how did that then fit into what we were thinking?
Yeah, so you're right on with the social determinants. These outside factors affect people's health, and so this 1115 waiver from the state through the federal government was trying to address some of those things. And obviously, the nutrition part is something that's right in our wheelhouse as a food, emergency food provider. And we were approached by an organization called Care Compass to see if we'd be interested in participating in this. So of course we do, pantry stocking. That's what we began with that. And in the course of those conversations, we talked about, hey, we have this idea about a kitchen, and that kind of perked them up because part of that nutritional component is medically tailored meals and clinically appropriate meals. And so these conversations led to one thing to another, to them inviting us to apply for a grant to help maybe put a little bit of gas behind this idea of a kitchen. And we ended up getting it, and that kind of became our Kickstarter funds to launch the process.
So Scott, Les used the term medically tailored and clinically appropriate to describe the meals. What does that mean?
A medically tailored meal, you have to have a diagnosis. You have to also be eligible through Medicaid to receive that. Clinically appropriate is the same exact thing minus a diagnosis. So the other differential is we are currently looking for a dietitian for the medically tailored meal. We have to have an in-house dietitian for that. For the clinically appropriate, we can work with a dietitian that doesn't necessarily have to be in-house.
And so these meals then are going to be prepared in the kitchen.
Correct.
And we're using some of the products that come into CHOW that are close to their use by day and all that kind of stuff. So, like what kind of meals do you anticipate us being able to do? Because it's kind of, your day is going to look a little like if people know the show Chopped, they'll get a little bit about what it feels like, right? So,
absolutely. I think every day is going to be a little different. We never know what food is going to be coming in, what we can utilize. It's going to be a lot of working with a dietitian to make sure that the meals are appropriate for each individual, and it's hopefully will be a smooth transition into that coming up very soon. So,
And what we were hoping is to be able to utilize, so each meal is going to be able to be delivered maybe to one of our pantries, and it will go out through our pantry system to people who kind of qualify for it too. So it's going to be a little bit different on the front end, right? Like when people call in, they may end up having to get referred to a
I can envision this prepared meal program as kind of like a Swiss Army knife. It's got a lot of tools, a lot of possibilities within it, and that's kind of one of the beautiful things about it is we're preparing food, but we can make them medically tailored meals. We can make them clinically appropriate meals. We can make them sort of general meals that could then go out to a pantry. And I think that's an important thing to note, that these can be distributed through our pantries as well. Frozen, packaged, frozen, and is distributed to folks who don't necessarily meet a Medicaid waiver or aren't on that program, but do have food needs. So we're not just limiting it to one tiny slice of the population. This has many different opportunities, and that's to me makes it really even more exciting.
Yeah. Now, is that what attracted you, Scott?
It is.
One of them?
It's helping people. I mean, and the love of food and the passion to provide for the community.
My guests today are Scott Bombard, who is the new chef at the executive chef, the head chef, lead chef, whatever you want to, the chef at the Broome County Council of Churches. He's going to have a staff that's working with him in a kitchen, and he is currently trying to just basically get this whole program off the ground. And we have Les Aylesworth, who is the director of CHOW, and we've been talking about some of the things that are going on. So what else is going on at CHOW? I mean, it's kind of interesting how everything is kind of coalescing in this direction. I mean, we're starting this at the culinary program, but we also have a building program that's going to go on around this. We also have the junior league. So fill us in a little bit more or less. I mean,
it's pretty wild, and it's kind of what I said earlier. When we think about innovation, we've talked about. I jokingly call it the CHOW way. You just never know what's going to happen, and if it's crazy, we're going to do it. And so, as you mentioned, we're going to kick this off in the SUNY Broome's Culinary Institute. We're leasing a kitchen from them. That's going to kind of where we get our baby steps in before we learn how to walk. We're going to eventually build a kitchen within our building, a full-size commercial kitchen within our current boardroom. That's where we're envisioning that.
And we received a pretty significant grant.
We got a significant grant that will be
paying for it.
That will be definitely helping big time. And then about a year ago, I was approached by the Junior League, and Junior League is a organization of women, with civic-minded women who really want to impact the community. And so they came to me with this crazy idea of, number one, they wanted to address food insecurity, and of course, they came to the right place. This is what we do. And they said, we have this idea for a food truck, and what we want to do is we want to take recovered food from restaurants and turn them into meals and bring them to people that can't get access to food. We want to bring the food to them. And I was like, oh my goodness, like this is, you don't know about it, but we're working on a prepared meal kitchen that is almost the same idea. And so we began that conversation. So where this is leading to is they are working on acquiring a full service food truck that will work in tandem with the kitchen. So be able to take, actually be able to make meals on the truck, but also be able to take meals that have been prepared in the kitchen and deliver them as well. So it's just really, really, really neat. How this thing is just kind of, it's like you light the spark, and then you just kind of see where the fire goes, and that's what's happening.
So how does it feel to be a part of that kind of a program, Scott?
It feels good. It's exciting. Lots of different things going through your mind as far as where this program could go. I think the biggest challenge is not limiting where it can go. So, keeping your mind open to all the different ways. You looked at it as a Swiss Army knife. I kind of started looking at it now as a tree. We're building the root system of that tree, and as it's starting to grow, the branches are going to be different parts of this huge, opportunity. So
Yeah, it's going to be kind of a different situation for you too, because you'll be, at one moment you might be cooking in a nice kitchen and all that kind of stuff, and another you might be working inside of a food truck.
That's true. And it's it's definitely never going to be a dull moment.
Yeah,
which is great.
Yeah. So Les, I know that in many ways what we've been talking about is kind of transforming the food system in Broome County.
Yeah.
Because we talk about how CHOW is that receptacle of food that's close to date. We get a lot of community love and support and other kinds of things that kind of come in from that. But then we're currently working toward this idea that we're going to be able to use that food to give it to the community and help the community feed itself in that kind of a way.
Mm-hmm.
Like, how do all these pieces kind of fit together, do you think?
Yeah, well, I mean, for one, we have a needy community. I mean, a report came out last year that Broome County is the second highest poverty rate in the state.
Right.
And so, like, as I joke, semi-joking, we don't want to be podium on that one. We don't want to be on a podium for that award. And so we have to do something to address that. The city of Binghamton has nearly 1 out of 3 people live in poverty. That's a huge number. And so that we can assume that all those people are pretty much food insecure as well. So, we're dealing with a huge problem. And, huge problems require a multifaceted approach and, not just one thing. That's kind of how, food banking has been for decades. It's this one kind of approach of we give food to pantries and people got to come to a pantry or a soup kitchen, and that's that. That's not fulfilling. That's obviously not fixing things. If here in 2025, Broome County has the second highest poverty rate, and we're still struggling with food insecurity, we've got to take different approaches. And so, taking this multifaceted approach of we didn't even mention the Greater Good Grocery Store, which is a whole nother part that we've done to address this issue.
This is kind of what I'm getting at. I mean, the thing is that a wicked problem, which is what we're describing, a wicked problem for our listeners is usually a problem that can't be easily solved.
Right.
Like a regular problem is, I'm feeling hungry right now, I'm going to go to the refrigerator, I'm going to get something out, and I'm going to eat it. When you're dealing with a wicked problem has many different moving parts, and you have to kind of look at the problem outside of just like one. Like the answer we think is just food, right? So food is the way that we're going to feed the problem, and then it's going to somehow get resolved. A wicked problem, however, would say, yeah, that may be part of the solution. Food obviously is part of the solution for it, but here are some of the tools that we have available to us. We know that people can get SNAP, people can get WIC, people can get, and so then you piece out, like, how do we help expand SNAP? How do we help expand access to WIC? How do we do for people who are falling through the gaps? How do we help those folks?
Right.
And so then we're looking at it through the lens of a grocery store. We're looking at it through the lens of a food truck. We're looking at it through the prepared meal program. It's more insidious and deeper than what we think.
Right.
Than we think at that point. Right.
Absolutely. I mean, this one approach doesn't. There's an old saying, like, if the only tool you have is a hammer, everything's a nail. And we have to have more than a hammer. We have to have a screwdriver and a wrench and all those things to actually get something fixed. And so that's what we've been trying to do. And that's one of the interesting things about the Council of Churches and CHOW is we've not been afraid to try different things. Maybe some people would think out of the box or maybe crazy or whatever. But like I said earlier, a big problem requires big ideas, and we're trying not to be afraid to lean into those big ideas. And
Scott, like as a chef, you understand this, right? Because
Yeah.
it's every day is that way, right? So how does being a chef influence your thinking as far as like how this program is going to grow?
I guess you kind of have to take it one step at a time. We're looking at it. I think we talked when I first started about getting that first meal out, and I think that's where the goal had to start. And then
I want to be there for that, by the way.
hopefully in 2 weeks, or actually one more week now. But I think you have to start with that first meal, and I think, I was talking to Les the other day about sometimes we limit ourselves and we try to see that end goal. And I feel like there's so many different options to this that we can actually grow this thing a lot bigger. So not only the medically tailored, not only the clinically appropriate, but the food truck, trays of meals for pantries. There's so many options, and it's from a chef's perspective, that's exciting because it's different every day. It comes with creativity, and it's just it's a great opportunity to not only serve the community, but also never have a boring day at work.
Yeah, and I would add to that, even as we've been discussing, we had a recent discussion about possible health outcomes. Not only, we've talked about a hungry community as an unhealthy community. We want to be able to, if we're giving folks food and meals, what are some of the actual tangible health outcomes? Obviously having food is important, but will we see reduced blood pressures and things like that? So it's, again, we're trying to address a lot of issues because, like you said, it isn't just as simple as one problem. There's lots of issues going on, so.
Food as medicine is another topic, and I'm sure if we
could talk a whole
we could
session.
have a whole program on that, and I think we probably will. I mean, at some point we'll have to have the folks from UHS on to talk about our an emerging partnership that we've got going on with them. But for today, I want to thank both of you for being on Encounter. Scott Bombard, who is the new chef, and we're very proud of Scott, and we're looking forward to the work that he's going to be able to do, and of course Les Aylesworth, our CHOW director, and for all of you, I hope that today you would find a way that you can help feed your community and to be a good and kind and generous person inside of our community. Have a great Sunday.